A meeting, June 12th, is 5:33 p.m. And we're going to start with item 1, public comments. And first, I'm just going to read a brief statement. The Board of Health provides the opportunity for the public to share their viewpoints and opinion on public health matters. It is not the practice of the BOH or agency staff, many of whom are top experts in their field, to review, vet for accuracy or grounding in scientific evidence, provide responses and public comments at Board of Health meetings. Opinions expressed by the public should not necessarily be interpreted as accurate if staff or the board does not challenge the perspective. With that, we'll invite public comment. Thank you very much.
All right. So we had 4 people originally sign up. Carolyn Beninsky is the only one who's online right now. So Carolyn, I'm going to make you a presenter, and your 3 minutes will start whenever you're ready. You should be able to unmute now, Carolyn. Are you there, Carolyn?
Okay.
Yep, we can hear you.
My name's Carolyn Beninsky. I live in Boulder, and I continue to come to speak to you because I think some of your policies are no longer relevant to what is going on right now. So I just wanted to first, according to the CDC, as you know, COVID shots don't stop infection or transmission. Therefore, refusing the shots do not present a public health risk. Furthermore, we now have significant evidence that getting more shots increases a person's risk of getting COVID. A large Cleveland Clinic study, which was published in April of 2023, showed that the more COVID shots a person gets, the more likely he or she are to get COVID. I'm going to just ask you some questions, and I have sent this to you in writing, so I actually included a link and some quotes from that study in the testimony I sent this morning. There's also a recent, I've also included a summary of a recent CDC study, which shows that increased myocarditis among young males younger than 24 years old who receive the COVID shots. I have some questions for you given these facts. Why are you, the Board of Health and BCPH, still promoting the COVID vaccine for children, given the fact that serious illness from COVID for children under 18 is almost zero and the risks of the shots are significant? Why are you still promoting the COVID shots to low income and people of color, especially Latinos? How are Boulder County Public Health and the board promoting these shots in conjunction with community partners, which you talked about at your April meeting? Do community partners provide information about adverse effects to recipients of the shot as required by federal and international law? Do they provide the information needed for informed consent? These people have gotten massive pressure for 2.5 years and they still haven't chosen to get the shots. Is it legal, ethical, or respectful to keep pressuring them to get an experimental shots with adverse effects? How about your funding? Are you receiving funding to promote the shots? These are serious, not rhetorical questions, and the public deserves answers from you. Thank you.
Thanks, Carolyn.
Thank you.
All right. Next is Ryan Scott. So Ryan, I will make you a presenter, and your 3 minutes will start whenever you're ready.
Thanks much. I have been meeting with you folks virtually here for far too long. I, again, would implore you to let folks interact with you in person. It would be far nicer. Again, will that ever come to fruition? I'm not sure, but it seems like you're one of the last groups in Boulder County or Boulder to hold out on that. So that's unfortunate. Again, just hammering home, I tried to look at this and say, how could you improve things moving forward? Don't lead with the policies that were so misguided during COVID. Don't lead with the coercion of enticing people with donuts and whatever foo-foo you threw at them to go get some vaccine or go do some XYZ action, whatever that is. Total nonsense. If that's part of your public policy, scrap it. Off the bat. You would have saved a lot of time and effort by not going down to your vaccine verification program. Whoever was in charge of that brainchild, rethink your approach. And I'm more looking forward and saying, don't do those missteps again. You vilified members of the community, often the healthiest folks out there like myself, that were not just minding their own business, and you had to come after us and go after businesses and find them and do whatever you did during that period, and it was completely nonsensical. And I can guarantee you, I'm continuing to hammer in the background on all these points, and I'm glad because my message is resonating with people. And I engage with anyone and everyone I can around town to deliver the complete opposite message of whatever you're pushing and whatever pharmaceutical you're trying to shill. So the CDC just a day ago confirms that COVID vaccinations increase the risk of myocarditis by 13,200%, as confirmed in a JAMA Network study. So you can go look at that. There's numerous things that have just popped up. This is by Matthew Oster. That was published on January 25th, 2022. That's old. Drawing on a few things. If there's any names for anyone that listens to this, go check out Kirsch. Go check out Ethical Skeptic on Twitter. And again, these people are just logging public records and public data. And that in turn tells a far different story than what you pushed with your models and everything else earlier on in this campaign. And again, I find it a little alarming because I see it as you guys kind of hiding and cowering from the public who you're trying to serve. And we're forced to come on video here, which is unfortunate. Anyways, moving forward, scrap whatever you did with the COVID vaccine. Don't push that for whatever the next scare is. Don't put that on the community. And hopefully you guide with more better guidance, like stay healthy in general, go work out, go do those things to stay resilient. Thanks.
Thanks, Ryan.
Thank you.
Cheers.
And I believe that concludes public comment. We have 2 other people that signed up, but they're not online.
Great. Okay, thank you very much for those comments. Our second agenda item tonight is approval of the May 8th regular meeting minutes.
I motion that we approve the May 8th regular meeting minutes.
Second. Okay, thank you. Motion and a second. All in favor?
Aye.
Aye. Great. Aye. Regular meeting minutes for May 8th approved. Item number 3, staffing announcement. So I am quite pleased that during the May 8th regular, they scheduled Board of Health meeting. The Board of Health voted to offer Dr. Lexi Nolan the position of permanent executive director, a role that Lexi has been serving the interim role for quite some time on her second round of being interim director. So we're really pleased, Lexi, to have you accept the offer officially on May 26th. And we're just really excited to continue working with you in this capacity and for your vision and your tenacity and your work with the staff and the community and our community regional partners. So I'm looking forward to continuing on this journey with you, Lexi, and congratulations.
Thanks very much. I want to express my appreciation to the Board of Health and to our staff for all of the support and all of the work in the recruitment process. I know it was a lot going on in addition to everything else. And, you know, I'm looking forward to figuring out how we can simultaneously dig into our priorities and also lighten our workload. But from what I've seen of this staff over the past couple of years, nothing's impossible. So we'll figure out how to do that. And I'm looking forward to working with you going forward. Thank you.
Awesome. Okay, item number 4, Board of Health consensus on preference and skills values of the next Board of Health member. So we will have an opening in August. Greg leaves us, moves on after over a decade of service on the Board of Health. And I think applications open July 7th. Great, oh, there we go. Good, so this is an opportunity for us to, we met with, do you want me to lead this?
You're hitting every single point.
Yeah, so we met with the Board of County Commissioners a few weeks ago, and we talked, they would like us to have a little more consensus as a board. We hadn't had a chance to talk about this, about what we feel like are high priority skill sets and perspectives in our recruitment efforts and as they're considering applicants. So as a reminder to anyone who's listening, the Board of County Commissioners actually makes the appointment to this board. So we can give them our input, but they will actually make the appointments.
I'm happy to draft the memo. I'm happy to work with one of you, have you review it, things of that nature. So any way I can assist. Yes.
Excellent. Thank you. And so they're up here is the summary of what we individually submitted as Board of Health members, and then what I think staff, is that management?
As a
team?
management team.
Yep, submitted as their priorities. This is open discussion with the board here.
And then Burke and Landry did not send anything. So
Okay.
it is.
Okay,
Anything additional that
Yes,
they had
beyond
added?
yes, thank you.
what they had submitted earlier. Anyone want to kick off with what you feel like are top priorities?
The top priorities under both seem like they're aligned, or at least with the equity piece. I'm not sure if BCPH is, I mean, the centering on race, I think I've heard that discussed numerous times before, so I don't think there's really any dichotomy there. And I think it's an important to top value that both the staff and us feel is warranted.
Yep, and I think the alignment with prior board experience would go hand in hand with the knowledge of strategic planning, operational planning, and budgetary planning. I think those are core functions of the board that, in other instances may not be as important, but because we're a management board and we have a different structure, I think it's important that we have somebody with that experience, ideally, in the past.
So I don't think we have any disagreement
No.
there.
I mean, I think there's like a melding though.
Yeah, I think there's a long
A
list.
3 bullet,
Right.
bullet.
That's right, that we could maybe consolidate. And I'll, in addition to the things that you two have emphasized from the list, I mean, I do think Greg is our only representative who lives outside the city of Boulder on the board right now. That feels it would be a priority, not at the expense of the other skill sets that we've talked about, but it would be great to have some geographic representation on the board also.
And I think experience, I'm curious what you guys think, but those areas may be good, but I think just having some sort of strong public health background, I think that bullet from BCPH is probably more on point in my mind. Maybe not issue specific, but understands public health.
Right. Not necessarily someone who has worked directly for a public health department, but somebody who understands how public health is different from, say, medical care.
Right, right, exactly.
Anything missing? This is like a synopsis of the document that all of you have sent in, so.
I mean, I think the, I appreciate the bullet of the time and capacity to participate because, we have had ups and downs in the past when under different boards. And you know, it's not that I think we only had to cancel one meeting because we had a late, we just didn't have a quorum at that time, but we haven't really had that challenge with this board. I mean, I do think that's like a value that we would discuss as part of any kind of interview process, or the commissioners would. So I'm not sure that that needs to be explicit. I mean, I think it's assumed that if you're applying for this board, you're going to give your time and energy to it. You know, the outside functions, sometimes those are during the day, sometimes those are not. And so, but between 5 people, generally, there's a way you can kind of cover that. But I do think some kind of committee or coalition experience, even if it's not a formal board, just that ability to show that you can come to consensus solutions. A lot of times the decisions are fairly routine that we make. I think they're straightforward. But obviously during COVID and, you know, when we have been without an executive director, that's when that experience really comes into play. So, I mean, except for the time and capacity for the commitment, I like all of the BCH points. And yeah, if all things are equal and they're East Boulder County, great. Then that can be a consideration. If all things are equal and somebody has experience that the rest of the board members don't have, then I think, okay, you know, if it was any of those 3. But certainly environmental health, because I do think that environmental health is, you know, it's an important part of public health, obviously. And this department is pretty strong from a regional and statewide perspective on environmental health. So again, if all things were equal and those were, you know, you had to say, well, what are those delineators? I think geographic equity and balance of perspective. So I think would be good. That's all I have to say about that. I'm not sure. I mean, I'm sure it's important, and the familiarity with community-based organizations. I will honestly say that I didn't really have that. And I'm not sure how much it hurt me as a board member not having that. But certainly I think you could blend a lot of these and then just say these are our shared values or shared perspectives.
I think there's some of these during that would be nice to have, but not critical.
Sure.
to the
Yeah, I
foundation.
think we could work on maybe prioritizing with,
Yeah.
right, these are the top things that I
Yeah.
feel like are really important.
I do think, Greg, I hear you on the time capacity, and I agree with, that would be part of the vetting, but I also want to acknowledge that I've sat on other boards that are much less time intensive. So I think we just need to make sure that obviously during the interview process or when we're talking to the commissioners that they, and I think they're clear on this, but it's a pretty hefty commitment, just given the role of the board. And hopefully that'll be, as we continue to evolve the board, it'll become smoother and smoother,
Yeah.
but I just think there's more of a commitment here than other types of boards.
Jordan?
Yeah.
Are we allowed to say something or no?
Go ahead, Kelly.
Yeah.
I didn't know if there's a protocol. And it's a small thing.
Yeah.
I like, you know, when it says person of color, how would you think about person of color and our cultural diversity in that space?
I was thinking the same thing, actually. I think it's maybe a little too confined in terms of the definition of what we're potentially looking for, so. But I don't know, Morgan, how do you feel about that, or Craig?
Yeah, I mean, so can you elaborate on cultural diversity and how you might? how
Yeah,
you think about
because,
that?
yeah, of course. So I think that I'll just give an example. Somebody who may have Hispanic, Latin, ethnic heritage, but they don't have the same cultural background, right? Whereas some people may have that same be that same person of color and have that sort of connection with or understanding of the different, what does it mean in that space, that cultural space, right? So, yeah, if that makes sense at all.
Yeah, I mean, it's, and, you know, I think that when I was putting some language in there, I said something about lived experience, and then we got feedback from the commissioners that they didn't all think that that was good language to use, or that it wasn't clear what that meant. And, you know, and that's fine. So I think I am really interested in what gets across a message of we want someone, ideally, I think, who has had a different lived experience than the majority of the
Yeah.
board in Boulder County, or the majority of this board. And that feels really important to me. And, you know, I do think ideally it would be someone who comes from a community of color within this community, within Boulder County. But I don't want to be overly prescriptive on it, I guess.
I think to Kelly's point, I love that the concept of having someone with a lived experience, whether it's an immigrant experience, or cultural background, and or someone who also might have another identity. And I think if we can broaden that, I think it would be good. Ideally, you want a person of color, but just because the board is majority white,
Yeah.
so it feels like it would be a good addition.
Yes.
There's got to be some good, maybe Julia can help us with this, because there's got to be some good kind of HR language that's kind of standardized, that will capture the essence of what we're saying, that can be put out in the community in a way that everyone would sort of understand. I think,
I mean, BCPH has language, right, that you all put on recruitment materials that we can be consistent with. And you know, to a certain, for me, if you don't understand what we're talking about when we say that, then maybe it's not the right fit. You know, like I do want to appreciate that not everyone uses the same language. So I want to be sure that we're to be inclusive in that, but feels like I want someone to have a good understanding about what it means to say, you know, values alignment with health equity, centering race.
And or other identities. I do think this is really important, and it would be good for the board to come up with whatever they want to center it on. Just because I think we've talked about this internally, but societally, there's a lot of stigma and a lot of pressure that's occurring outside of Colorado that, you know, all of our young people and everyone has to kind of face that, whether it's reproductive justice or trans rights. Like there's just a lot of legislation that's happening that's really harmful and can contribute to people's mental health and contribute to their stress. So, and for people of color, it can be very scary. So I do think having that as a forefront is really, really important because it's probably our future. And so even having someone with expertise or subject matter expertise in these areas might be super helpful as well.
So thank you for everyone for your comments. Would it be, I guess, in terms of next steps, maybe I can work with Jordan to try to come up with, here's like our top 3 things, and we'll try to look at the language that BCPH uses in their recruitment materials to see if we can be consistent with that and if it makes sense. And then circulate that with the rest of the board via email.
sounds great.
And then we can get that over to the commissioners before the July 7th
Yeah.
opening.
We also have some examples of other board recruitments that have been done recently that were attentive to those issues, so that we can.
Great. Yep. Super, that would be helpful context also. Okay, thanks everyone for your thoughtful input. Our agenda item number 4, which is kind of following on this, right? Oh no, sorry, that was number 4. Number 5, application questions. And I know the packet included what the current questions are. There's 3 of them, and then some other potential questions. Oh, great. There they are.
So from the potential questions, I pulled that from our contact at the Broomfield, their Board of Health application, so, yeah.
Thank you.
We also get a question in there about their experience. Maybe this is address number 2, but their direct experience working on a board.
Yeah, I guess like number 2 doesn't really like, I'm not sure I like that.
Current question number
Yeah.
2? Okay.
No, sorry, not current. You were asking about current question number 2. What are qualifications for serving on a board and what's your prior experience? You want to like add that to that question?
Yeah.
Great.
Because number 2 is very broad,
Yeah.
right? But I think we want to get at what's your actual board experience. Assuming that
Got
that
it.
makes it to the top of the list, which I think it did.
Yeah. And then in terms of potential additional questions, I mean, I have no problem with the current questions. I appreciate Lindy's recommendation, suggestion for change. You know, I do think like question number 3 under potential additional questions could be helpful in sussing out. Putting a little meat on that.
I would just recommend that if you're gonna ask individuals about their prior board experience, if they don't have any, the follow-up might be, what supports would you need? Because we don't want to create it's a real privilege to serve on a board and to be selected, and that can also hamper our intentions around recruitment of people with different experiences. So maybe it's like something that's going to get at what they would need to be successful, whether it's I can't physically get there, but I can log in remotely, or I might need some onboarding, something to kind of tease out so that it feels more inclusive.
And how do you get experience without getting experience?
Exactly. So it makes it really challenging to bring in new folks. I like number 3 too.
So let's just say you didn't have prior board experience. Let's say in any kind of like government level, but let's say you were a strong community organizer, right? Which, has its own skill set for sure, but is also somebody who probably has to balance different perspectives. And that might, open the door a little bit to people who just would automatically go, well, nah, that board's not for me.
Right.
But I like potential question number 2, and I would have said that in 2019, I probably would have said, do we really run into that very much? But obviously since 2020, I think that is a good
Got a little
question. to
spicier.
ask. Yeah.
I wonder too, if on current question 1, if you would be interested in adapting it a little, just to say, why are you interested? And what do you think you could bring to the board? Because
Yeah,
it might open it up a little more.
I agree. I feel like that was a question, since I'm the most recent board member. I think that was more of a question that I was asked. So it was more of an opportunity for me to really talk about my experience. And I remember I talked a lot about setting up the health insurance exchange and my relationship with community organizations. And so it just sort of opened the door, right? And I think you'll get more context for where that person's coming from with that kind of question.
So expanding on number 1 with the, and what can you bring? What skills do you bring to the board? Okay.
Yeah, maybe like that question, and maybe as fallen as, and what experience do you have directly with community-based organizations or something like that? So again, back to like, they don't have that experience, but there might be something that's akin to that we would want to know about, but just leaves it a little bit more open.
So sorry, I'm just thinking if we adjust that question number 1, then question number 2 feels like it's a little repetitive. Right?
Well,
Yeah,
two,
that's
two,
what
I think it's more about how you do conflict.
Oh, sorry,
Resolution.
talking current
Oh,
question number
sorry.
2, I know it's difficult. 2A
Let me,
versus 2B.
I think I can quickly change the PowerPoint, so like, yeah.
Yeah, that's
like-
don't worry too much about it.
Okay.
We can follow 2A
Yeah.
and 2B.
So if question 1 is why are you interested in what perspectives, experience, skills do you think you'd bring to the board? Number 2 could be, what are your qualifications? No, number 2 would be, I'm sorry, going back to Lindy's suggestion. What experience do you have working on a board, or what supports would you need to be successful? So we would focus both of those in a little bit more explicitly.
I'm just thinking also, we don't get to review these applications. Is that right? But you do, Lexi. You can review the applications and make a recommendation to the commissioners.
So, Robin, you will, send me the link to the applications. We will pull them, and then you would do, your ED recommendation to the Board of County Commissioners. And I have all the forms and stuff, so.
No pressure.
Just before we get
No.
too excited about these, we won't actually
Yeah, yeah.
get to see, we won't be reviewing, but we do want to make sure that the commissioners and Lexi have enough information to maybe make a good recommendation.
So on 4B, just a suggestion as well, I don't know what your thoughts are on this, but experience you have working on public health issues. I think it's also, because I think this is an issue ongoing right now, or what do they feel is the role of public health and understanding that role? I think that says a lot about how the person, how they view public health. If they understand it.
Yeah, that's a great
Well,
question.
especially in the context of the pandemic and how that kind of, the hope would be is that they're aware of that bigger picture and there was the push and pull, the struggles of people, just weren't on board and never were going to be on board. And so it'd be kind of interesting to hear them if they bring that up, right? Like, you're looking out for the entire population. You're not looking out for each individual, right? And you have to make decisions sometimes that way, and knowing, of course, that not everybody's on board. So I like that in terms of be interesting to see if they're aware of all of the challenges moving forward with the workforce and recruitment and retention. I think that could be a good open-ended question to really bring out any of the knowledge they have that maybe didn't come up in the first, 5 or 7 questions. Right?
Well, and that's another thing, I just getting to the number of questions. I think, Robin, if I'm remembering this right, you had recommended not going above 5 or 6 questions. Is that right?
Hi there, Robin Valdez with the Commissioner's Office. Didn't expect to be talking today, but that's okay. Yeah, I think most of the applications that we have currently, I think we have around 30. Each board has different questions, but some of them are similar in nature. I would say, I mean, some boards ask more questions. I would say maybe 7, but most of the boards have around 5 questions thereabouts.
Okay, thank you. I mean, yeah.
Oh, I was just gonna add that I think for the quasi judicial boards, which are the Planning Commission, Board of Review, Board of Adjustment, they sometimes they ask a little more questions from applicants.
Right, we want to balance the line of not discouraging people from applying because the application is so long, but also that's part of that commitment too. If you don't have time to do the application, then you might not have time for this board.
Do you interview at all?
County commissioners do.
Okay.
That's their, and then they made the official appointment.
Okay. I was thinking also if it's long, if English is the second language, that can be really challenging for some folks, so. It's like finding that balance.
Great. Are there any that we up here that we might eliminate based on them trying to shorten it a little bit?
You
Are
know,
you
I think this
asking
is,
me? Oh, sorry.
I think Morgan, I think this is, at least in my recent history and memory, this is pretty consistent in terms of the length that I.
Okay.
Yeah, so I think it's fine.
Okay.
Okay, yeah. And I actually really appreciated Kelly's addition to number 4, which is, you know, you can also start to not just, you know, hearkening back to COVID, but also DEI and how, you know, I think there's a real opportunity there to expand on like the role of public health and get a better sense of where that person is coming from, especially in the context of some things that are so important to.
And make sure that they understand that we make some decisions at this level, but there's an
Yeah.
awful lot that we have to do that is not really an option for us.
Right. Yeah, that's a great point. Like you're part of a giant ecosystem. Yeah.
Yeah, I have to jump as well. I appreciate the ability to add any comments and, you know, for me, the last part also was, you know, in the American system, people don't often look at public health as that preventative side, right? We're really focused on the curative piece so much. And it would be great to have somebody who appreciates and understands the importance that public health makes in preventing disease versus curing, things like that. So anyway, I gotta go. Thanks.
Thank you, Kelly.
Okay, good one.
Thanks for shooting in your comments.
Yeah.
Take care.
Okay, so everybody likes all those questions plus the ones that we,
Yeah, because I do think that there's a possibility that in the first couple questions, people will share a lot. And so like, let's say you got to 1B. They might have already talked about that in their response.
and actually that was gonna be the one question I might suggest scrapping,
Yeah.
because I feel like you could.
I think with the
if you had
additions to 1 and
experience that you
2A,
could, yeah,
then I think you can wrap
Cover
that
that.
in, and then 6 questions seems very
Yeah.
reasonable.
okay, let's do that then, let's scratch that.
Like leave question 1, a potential question 1 about the community-based organization.
No, yeah, cut that one. Cut it.
We'll wrap something like that into 1 and
Something you
2A.
reflected in the earlier about tell us some of your experience that would make you.
Then potential question 2, leave that one.
Yeah, I mean,
Okay.
I feel less strongly
Okay.
about number 2, but Greg, you like it, so. I don't like,
Mm.
you shouldn't join a board if you can't deal with people with differing opinions.
Yeah.
But maybe you're interested in their style of working it out, I don't know.
I think that's an important question, absolutely.
Okay.
I think everyone comes with different experiences and I think it'll reveal potentially something.
Yeah, I think it's good.
And again, just reflect on how, when I went through this, you can say the same thing again, right? Like you can reinforce a point. You can, you know, as you're thinking about how you're constructing your answers, so it doesn't, these are open enough where I think people can take creative liberties how they want to answer any of these questions.
And we pulled a couple other ideas like the type, like we mentioned the time commitment volunteer board or working with the ED, but if that seems like it could be more, once you're here, these conversations are still evolving with the current members that we have, so.
Yeah, and I think that thinking of the qualifications and skill sets that we discussed just a little bit ago, that these questions would then get to those reveal.
Okay.
Those.
Yeah.
Does that feel right? Okay.
Yep.
I guess next step, I will draft all of these again, Lexi and I will make sure, and then get I'll send to you an email.
Super.
That works. Great. And I'll pass on. Oh, yep, Robin, do you have a comment?
Just a quick one, just to make sure that you send the questions sooner rather than later, because
Yep.
I need to have the web developers add this. It's not as simple. This was This is a homegrown application that was done by IT. So yeah, the quicker, the better. Thank you.
Perfect. Thanks, Robin.
Thanks, Robin. Okay, great. Thank you. Item number 6, director's report.
It was pretty chock full this month. And I know that we don't want to dig into anything particular, which is great, fine. I'm happy to answer any questions. I will tell you that Jordan and Catherine and a few of us are working on building out a Board of Health agenda calendar that we're hoping will give you a greater ability to kind of preview what we'll be talking about. We are working to find a time to bring you to come to the management team so that you can very clearly communicate what it is that how you would like to receive information from the staff. We have been working on getting this director's report to a more strategic level. I would point you to this month's harm reduction report as an example, and we'll continue to work on that. There's a lot going on right now, and we will continue to keep you informed both through director's reports and if something is a little bit more urgent or timely through emails.
Great. I do have one question, Lexi. I know I asked this a little while ago because I have followed this for quite some time. St. Vrain opted out of doing the Healthy Kids Colorado survey many years ago. They do some sort of survey. Can we get access to that information? And is there comparable data between BBSD and St. Vrain? I mean, I know they don't do the same survey, but are there some questions that are consistent that could be compared?
I think it's a great question. I will check with Allison about whether they share that information with us. My understanding from her is that they share some of it, but they do hold it a little bit closely. But I think it's an important question. Obviously you saw that we did the Healthy Kids Colorado information release last week with the community. We have a meeting on Tuesday that'll be in Spanish. But it's just BBSD.
Mm-hmm.
And so there is that question about, how do we best support and respond to the needs of St. Vrain as a school district? And I think it's a good question. I think as we get deeper into the MBH work and the planning, we will continue to pull our school district closer to us in terms of co-developing what the plans are and what the needs are. And I'm happy to get back to you all on that by email.
Thank you. Yeah, if they're doing a survey and they're a public school district, they probably have to release that information also. So whether or not they send it directly to public health, I have to imagine we could access the results of that survey if they're doing actually a district-wide survey. So
yeah,
it would be, and I do, thank you, because I do think it's important in the context of mental and behavioral health, because there's a lot of really important information in what data that we do have.
Lexi, this is gonna probably be a random question, so we can take it offline or address it in the next meeting, but given the significant amount of rain we've received this spring, is there any concern from the vector control area about what a restart? I just skimmed through to make sure I didn't miss it, but any updated reporting trends that we're anticipating? I think everyone's a little worried about what's coming.
So we've been seeing increases in vector-borne diseases over the past few years. I think we're, including things like West Nile, particularly the mosquito driven diseases. There is a concern. I don't think we have a sense yet of any data coming in that's pointing in a different direction, but everything we know about the science suggests that we should be paying attention to it. So I'm happy to report back to you on kind of what our team is thinking in that space.
Okay, great. And then the harm reduction was notable. Could you just talk a little bit more about that event and how pervasive this problem is in the community? I'm not very well versed on this issue. So I'm curious if you could just provide a little bit more context for that.
Are you talking about the xylazine?
Yeah.
Yeah, okay, so, right, so a number of weeks ago, we were notified that we were starting to see xylazine in the street drugs.
Yeah.
And we were concerned that some of the overdoses that we were getting, might be due to that because we weren't yet testing for it.
Yeah.
Regularly. This is, this is a horse tranquilizer. It's used to extend the high of other drugs, so it's often mixed with other drugs. It is not actually responsive to naloxone, but the best practice is to go ahead and administer naloxone because it's so often mixed with other drugs that it can kind of compensate. We have been notifying our community partners about this. We have ordered test strips. They are very expensive. But we do feel like there is a question right now about how prevalent it is in the community because we haven't been testing for it.
So we don't have prevalence data at this point. That's all.
We don't.
Okay.
We are beginning to hear other counties are starting to see it. So, yeah, it's a layered problem in that space.
Was there a spike in overdoses? Is that what led to the awareness of it, or was the police or sheriff discover it without?
I wish Indira hadn't quite left yet.
I kind of remember reading in the paper and I'm trying to remember what it
Right,
said.
I think that there was, I think that there was an incident where someone was tested for it, at the hospital. And that is what triggered, an awareness that this new drug was in our system. We are, it's interesting, we have this OD map tool now, which gives us much closer to real-time information on where overdoses are occurring in the county. That we are hoping is going to give us an opportunity to both be able to be more responsive for harm reduction, but also to think more carefully about where our prevention efforts aimed. I'll be curious to see what we start seeing in that space in relation to the OD map.
Yeah, I'm guessing it's probably too soon to really know, but like the extension of the high, right? So do we expect to see a drug mixture in like chronic homeless communities, or do we expect to see that in the kind of recreational user community?
I think it's just street drugs. If you're purchasing drugs from.
And you may not even know what you're getting.
Or getting it from friends that was not a prescription, you don't know what's in it.
Okay. And there's like a nasty side effect with that xylazine, right? In addition to extending the high, which the user would say that's a good thing. But isn't that the flesh eating one or the sores?
Wounds don't heal.
Okay.
Yeah.
Yeah. Trade-off.
Yeah. Okay, thank you. Any other questions? The director's report?
No, I thought it was a good question, Lindsay, about mosquitoes, because, we have a mosquito program in Denver, and if the weather pattern changes starting this weekend and it gets hot for a week or two, oh man, mosquitoes, I just can't imagine they're not gonna just be out in swarms. So it's gonna be a really important summer, especially if we get monsoons again in July. So we're gonna have a narrow window, but by then the mosquitoes could be in full bloom. And the other thing is back to the xylazine, do you get statistics from the medical examiner's office about the autopsies that they've done on suspected, just drug overdose deaths, right?
We do. But the challenge that we have is that it's often so far after the fact.
Yeah,
That
right.
it's not particularly actionable. It can often take many months for that information to come back.
Yeah, good point.
Yeah.
Last question. How is the budget planning process going?
swimmingly. No,
That's all I needed.
we are hard at work. We are simultaneously working to wrap the 23 amended budget.
Yeah.
Catherine and team are working. I will turn it over. I'm happy to turn it over to Catherine.
You're doing great. I just
the coffee today.
just wanted you to know I'm here in case you have any questions.
Well, I noticed in the report, what was the word you guys used? County has moved up the timeline drastically. That was like, oh, that gave me a good indicator.
Yeah, so along the lines of what Lexi's sharing with you, we did a recent presentation to our management team to just let them know what it looks like. And basically that the finance and budget team is really going to be hiding for the next month and a half. Because where last year when all the systems were trying to get into play, we had a much longer time, which actually was beneficial to us with me being new and the finance team being so new and trying to figure out all of the items. But this year, now that they've gotten a lot of those systems in play, they're trying to shift it back to where it was previously. So rather than having like an extra 3 months, we really have about 2 months to do all of the work, including even meeting with you and getting your thoughts and feedback on the budget.
Okay.
And you should be expecting to see a request for the budget study session very quickly.
Okay. I think originally in the email is going to be July, but do you think it's going to be August? The budget study session in August, Catherine? Or?
I think that's initially, actually, I have the PowerPoint right in front of me, so just let me take a look real quick.
Okay.
Yes, so preliminarily, we suggested around August 16th to have the budget study session.
I'll send out a good old doodle poll.
Go and get on calendars.
That's back to school day. I
Yeah.
think.
Yeah.
And we can give you some options.
Yeah.
Okay.
Yeah, it's great.
That's great. Thank you.
All right, any other
Looks
questions?
like I won't be part of that one.
All right, keep up the good work, Catherine. Thank you.
Don't you have to be an honorary?
Your term goes until August 31st.
Oh, that's true.
Then
You get to study away with it.
By then, we'll have a new appointee, we'll be good.
Okay, item number 7, old and new business. Anyone? No?
Nothing
Okay.
for me.
Item number 8, adjourning the meeting at 6:26 PM.
Good job,
Thank you,
Morgan.
everyone. Great fanfare.
Thanks, everyone.
Thank you.
Thank you.